hope this finds you in good health and spirit. As always, it is so good to have you with us from the beginning of the show to the end of the show. My name is Charity Gordons and this is the Wholly Healthy Show. With me in studio is Mr. James Morongo Njao, who is a registered pharmaceutical technologist. He has been with us in previous shows and we are more than excited to have him yet again to come and continue teaching us about health. Thank you so much, Mr. James.
Thank you.
Welcome to our studios.
I want to appreciate for giving me another platform. We've been here again and we've discussed health issues, and we are here also to expound on the issue of health. As we always say, health is wealth. Yes.
Very good. So today we are talking about diseases. Please take us through diseases. What is the real definition of diseases? What are diseases?
Well, in relation to our previous topics, physical health, we said, is also the absence of diseases. And that is why today we want to approach the issue of diseases. Number one, we also want to understand what are diseases. And we normally say a disease is any condition which results in the disorder of the functioning of the body. Those disorders are the ones that we call a disease. And by disorder, I don't mean that those disorders that we have been, the disabilities that maybe someone is born with, but the disorder, the effect in the functioning of the body, those are what you call the diseases. And basically, we always say that diseases, they are not good. I will start with the bottom line, that diseases are not good at any given time. Because whenever we are suffering from any disease, whenever our normal body functioning is not evident, that is always a challenge in us. And not just us, but a human, as from an infant to an adult. And even a fetus, when is before birth, an infant may be having some conditions that are not favorable. Diseases are not good. That's the bottom line. And we normally say that diseases are classified into two. And those two classifications, we normally say it's we have communicable diseases and non-communicable diseases. And I'll start by defining what communicable disease is, and then we expound also on non-communicable diseases. Yes, communicable diseases, in other words, is what we call contagious diseases or short-term. Mostly these are diseases that are just short-term. Contagious. What do you mean by this? They are caused by microorganisms that transfer from one person to the other, or from one host from a parasite to the host. So these are diseases that can be transmitted from one person to the other, or from an animal, wherever you get contaminated to someone else. Those are the contagious diseases or communicable diseases. And how are they transmitted? Communicable diseases, as you said, is from one person to the other. Basically, it can be through the mouth, through the nose, throat, or respiratory system. And in that context, mostly these are like the conditions like in colds. This is where you find the colds are transmitted from one person to the other, simply because those are airborne. It can be transmitted through the air or through the body fluids. So like through the air, that is airborne. Through the fluids, you always talk of waterborne diseases. So another form of transmission from one person to the other is through other forms like physical contact. If you get contact skin to skin from one person to the other, that is also another form of contagious diseases. And an example of this disease, we can say like skin infections. Those are like the fungal infections. We have conditions like the scabies. These are diseases that they move from one person to the other through like sharing of clothes. Then you also have transmission through sexual. Those are the STIs, the sexually transmitted infections. Those are the infections that move from one person to the other through sexual contact. Here we are talking of conditions like gonorrhea, syphilis. We have HIV, and also we have the urinary tract infection, which are transmitted from one person to the other through sexual contact. Also under these communicable diseases, we still have insects through bites. Like we know of a condition like malaria, whereby it's through contamination. If you get a mosquito bite that has those malaria parasites in them, that is basically how you would find yourself in contact. Also, we have basically the communicable diseases is from one person to the other, and it, as I've mentioned, is through many forms. And you find even the healthcare providers, some would find themselves with those diseases through like needle pricks. So mostly we are talking about contagious conditions like colds, those conditions like malaria, HIV, all those that I've mentioned under the umbrella of communicable from one person to the other. So in that context also we have the non-communicable diseases. And under the non-communicable diseases, we normally say that those are the diseases that they are not from one person to the other. They are those conditions that just they are those conditions that are not contagious. They are not transferred from one person to the other. An example of these diseases it's disease like high blood pressure, cancer. Those conditions are the ones that we say they are non-communicable. Yes.
Okay. I'd like us to talk a little deeply about the communicable diseases. When it comes to communicable diseases, some of them have very similar symptoms. Is it possible for you to take us through maybe different communicable diseases and maybe the symptoms that we expect from them? Because I'm sure so many of them have the same kind of symptoms.
Well, that's a very good question. When it comes to communicable diseases, most like those infectious, those from microorganisms, because basically quite a greater percentage of all these communicable diseases are through the microorganisms. So like a good example is a disease like, I would give an example of a disease like meningitis and malaria. These are two infectious conditions that present the similar symptoms, in that you will find there is diarrhea, there is vomiting, there is headache. But if not properly diagnosed, you would be treating mostly meningitis, because it's more severe. You find it would be treated as malaria. But normally what happens with these contagious ailments, it's very easy with proper diagnosis. the tests done in the lab, they would clearly show what specific microorganisms are acting on the host, now the person who is sick. And with that, you will be able to properly diagnose and differentiate these two conditions. You even find most of these upper respiratory tract infections, the coughs and the asthma thing, most present in not asthma, the coughs, the normal cold, they present in similar ways. So with proper lab diagnosis and proper management by a healthcare provider, by the right healthcare provider, you find that these conditions are well taken care of. Yeah.
Very quickly, before we go on a short break, I'd like you to help us distinguish between cholera and typhoid. Those two diseases are very similar, but people do not understand what is the one thing that distinguishes cholera from typhoid.
Well, when it comes to cholera is more severe. Typhoid is one condition that you can stay for a while without diagnosis, with those abdominal pains, frequent, a little bit frequent, not really frequent diarrhea, but it's a condition that progresses with time. But for cholera, immediately the cholera microorganisms, you happen to, if you happen to be infected with cholera, it only takes hours for you to go in a... Basically, cholera is much severe than typhoid, and cholera is one disease that can kill you in 24 hours, because cholera is a continuous bloody diarrhea. But with typhoid, there are those abdominal discomforts, and you would still run your daily activities before it gets severe. So the gestation period of microorganisms, of typhoid microorganisms, is longer than the cholera. For cholera, it only takes hours. And that's why whenever there is an outbreak of cholera, much deaths are recorded, simply because cholera is one condition with the diarrhea rates. It dehydrates the body, and it leads to death very easily. Yes.
That's great, that's great. Viewers, I hope you are enjoying our show today. We are talking about communicable diseases and non-communicable diseases. That brings us to a short commercial break, but when we come back, we're going to look at the non-communicable diseases. So keep it Champions TV.